Okay, hi. This is Sarah again, and today I'm going to be performing range of motions once again on this baby doll over here. Oh my gosh, Sarah, come on now. Oh, tilt, tilt, tilt. Okay, so, oh gosh. The first thing that I'm going to do is check the order of my patient to note any limitations that she might have. There we go. Yeah, so any movement limitations that she has. The next step I'm going to do is wash my hands and don any PPE that I need. So for this one, I'm just going to be using hand sanitizer and going for 20 seconds in between the fingers, yada yada. 1 inch above. Checked off on this one. Okay. And then I'm going to be putting on gloves to protect myself and my patient. Okay, the next thing that I'm going to do, I'm going to be raising her bed to a comfortable level with like the bed rail up while I identify myself and I identify her, and I let her know that my name is Sarah, and I'm going to be doing some range of motion activities with you today. I'm going to be seeing how well your joints are moving, if there's any stiffness, and we'll just get all of that documented for you. And can you tell me your full name and your birth date, please? And maybe where you are. And she says that her name, once again, is Jana Rader, and she was born on May 11th, 2018. Wonderful. And she tells me that she is in bed and that the wall is blue. So, what we're going to do now, we're going to make sure that the bed is lying flat as she can tolerate it. So we're actually going to move these pillows, and I'm going to raise this to a comfortable position. Like I said, I'm going to make sure that the patient is close to me. That way I'm able to do the range of motion activities a lot easier. I'm going to pull the bedside curtain closed so that we have privacy, because that is super important. I would get my equipment, but I don't need any equipment for this. So I'm going to stand on the side that is being exercised in each of these, like for each side, yeah. And then I'm going to lower the bedside rail, and I'm going to instruct and also assist, because it's a baby doll, with the starting at the head, moving down to the toe. So what we're going to do first, Jana, we're going to tilt your head down to touch your chest. I'm going to move this down so I can see your chest. And then back. And we're touching the chest, or chin to the chest. Wonderful. And then we're going to be turning our head, doing a no to each side. And you need to let me know if there's any pain while we're doing this. Perfect. Okay, and now we're going to tilt our head so that our head, oh, I see that there's some stiffness there. Our head to touch our shoulder, and we're just going to go as far as you can go. Okay? And there we go. Yeah, sometimes one side is a lot easier to move than the other side. I get that. Okay, so once we have tested the neck, I'm going to lower this just a little bit more. I'm sorry, you can't really see my face when we're doing that. Okay, so we've done the head, and we're going to be moving down to her arm, and we're going to make sure that we only expose the part that is being used. Okay, so we are going to lift her arm up and down, up and down, making sure that we aren't holding on to the joints while we're doing this. And then we're going to move her arm out and in, out and in. Then I'm going to be moving your arm over as far as we can go, and out to regular, in and out. Okay, now we're going to bend your elbow, and we're just going to bend it 90 degrees, then bring it back, bend your elbow 90 degrees, bring it back. And now at 90 degrees, we're going to go ahead and try to touch your shoulder with that arm. Good. Touch your shoulder with that arm. Wonderful. Okay, we're going to now place your arm down, and we're going to turn your wrist so the palm is facing down. Well, that's a bit stiff. And then we're going to face it up. Oh, that's not happening. Face it down, and then we're going to face it up if we can. Okay, so we see some wrist blockage there. Okay, can you make a fist for me? So we make a fist. Wonderful. And make another fist for me. Great. And now we're going to tilt your hand with your hand up, facing upward. Well, okay, her hand is not going to face upward. So we're going to bend your hand back as far as we can, and down, back, and down. Then we're going to be going inward, like we're calling for a puppy dog, and in, okay? So we're going to go back, and back to regular, back, and back to regular. Now we're moving it down, good, and down, wonderful. And now I'm going to be separating each one of your fingers. And now we're going to do that a couple times. Each of these I would do 2 to 5 times. Okay, now we're going to touch your thumb to each of your fingers. Good, again. Wonderful. Okay, now I'm going to go ahead and place that under there. Okay, now we're going to move on to your leg. See your leg? Okay, the first thing I'm going to be doing for you is lifting your leg up and then down, up and then down, okay? And then I'm going to be moving your leg outward as far as possible, and in, out, and in laterally. Once again, we're doing each of these twice. Then we're going to move it into the middle line and out, in toward the middle line, and back out. Good. And now I'm going to turn your knee inward and out, in, and back to normal. And then turn the leg outward. Good. And turn your knee outward. Perfect. Okay, now I'm going to make it so that you're bringing your knee up toward your chest, okay? So I'm going to go ahead and grab your foot and behind your knee, and we're going to go and bend inward. Good. And down, inward, and down. Perfect. Okay. So now what we're going to do, we're going to move on to your foot. We're going to act like we're pressing on a gas pedal. So I want you to push down, good, and up, down, and regular, good. And now you're going to be acting like you're lifting your toes up to the heavens. So lift your toe up, good, and down. Lift your toes up and down, wonderful. Now I'm going to be separating each one of your toes. Do that twice. Good. Now I'm going to be turning your foot, your ankle. We're going to be moving your foot outward, turning your foot inward. Oh, some stiff baby doll. Outward and inward. Good. Okay, and we're just going to try once again turn these feet because I forgot if I did them or not. So we're just going to do it again for good measure. So in, and out, out. Good. You're doing a great job. Okay. Now, if any of that hurt, you need to let me know. Okay, so I'm going to raise up this side rail, and then I would move to the other side of the bed and do all of the same things. So, I'm not moving to the other side of the bed because this is a huge bed. And so I'm going okay, fine. I'll do it. Okay, so, goodness gracious. Apologies. Move to the other side of the bed. Help move Jana over. Oof, for this. Oof. Okay, I've already done the head portion, so I don't need to do that again. So, we move on with the arm. We go up and down, out and in. We're supposed to be doing this slowly. And then inward, out. Bend the elbow 90 degrees, down. Bend the elbow 90 degrees, down. Bend that up to the 90 degrees, then touch the shoulder, back, touch the shoulder, back. Okay, push the down and backward, your hand toward your elbow and back down. Pull your hand toward your elbow and down. Now away toward your forearm. Push your hand away toward your forearm. Then go ahead and make a fist for me. Good job. Make another fist for me. Good. And then we're going to separate each one of your fingers. Good. And then turning the arm and then up, turning it backward. So it's going like this, and up, down, and up, down, and up, down, and up. Good. And then touch your thumb to each of your fingers. Good. Perfect. So we're going to put that down. Then we're going to move on to your leg, Missy. We're going to lift your leg up and down, out, in, ambulate in, and in toward the midline. And then we're going to turn our knee inward and outward, inward, return the middle, outward, return to the middle. We're going to bend your knee to that 90 degrees, or try to act like we're getting it to kick. Okay, this knee is stiffer than the other one, and so I document that later. And then we go down to the foot, and you're going to act like you're bringing your toes up to the skies, and then pressing down on the gas pedal. Good. And we're going to turn your foot inward, turn your foot outward, turn your foot inward, turn your foot outward, and then we're going to be moving each one of your toes. And then we're going to turn your toes downward, just make them go like this. I don't know if you can see that, down like that. So make that with your toes. Good. Bring it backward. Good. Okay, and then we're going to go ahead and turn the ankle, so in, out, in, out. Good. We're going to cover her back up, put the side rail back up. Okay. And then we're going to put the bed back in its lowest position. We're going to put the bed back in a comfortable position for her as well. If she doesn't want to be lying all the way down, then I would put the bed back into a seated position for her. But the bed does need to be at the lowest position. I need to make sure that she is comfortable, and if she has any, I'm going to make sure the call bell is next to her, and ask her if she has any questions. Make sure that are you comfortable? I think that I've said that like 10 times at this point, but we're going to make sure she's comfortable, has everything that she needs. She has the bed table by her. All of the tubing is back to where it should be. Both of the side rails are up for safety. And then the last thing that I do is when I'm at the door, I remove my PPE. I perform hand hygiene, and I document that the range of motion was done. And I believe that that's all that we do. Bye.